All right, so these are some knee exercises, really a lot of knee stretches that we can do right after a knee surgery or procedure. This one's called a heel prop, and what we're doing is trying to establish equal extension or getting the knee just as straight as it does on the other side. It's really important after surgery. And so with the heel prop, you can use any sort of bolster, a bump. We just got a simple padded bump right here. You can use a roll of towels, blankets, pillow, or something like that. And what you want to do is place the bump from about mid-calf down to the ankle and foot. And as you can see, gravity starts to pull that ankle down into maximum extension, and that really helps us keep the knee stretched out. And right after surgery, it's really beneficial to keep your knee in this position when you're resting on the couch, watching a movie, just hanging out or anything like that, and not resting the knee like this. Right after surgery, it might feel more comfortable to be in this position, but what can happen is that the knee begins to get tight and it becomes more difficult to get the knee all the way straight during the rehab, which can become a difficult problem to overcome if the knee starts to get stiff in that bent position. All right, next knee stretching exercise is called towel stretch for extension. It can be a towel, it can be anything really, it can be a rope, something that you can wrap around the foot right here. And this really helps pull the knee into full extension, really trying to get it to be just like the opposite knee. And so we'll start off with your towel, your band around the knee, and you're going to use one hand to pull that knee straight. You're going to use your opposite hand and you're going to put it right above your kneecap, just like that, and you're going to push down with the opposite hand, which helps stabilize the knee, and then you're going to pull back with this hand. What that really does is help stretch out the back of the knee and help pull that knee all the way into full extension. All right, the next stretch is called towel stretch for flexion. We're going to use the band or the towel to pull the knee and bend the knee so we can get all of our flexion back. And so we'll start off with something like a towel. And what we found to be really helpful is if we actually wrap it around just like that, we cross it behind the knee, and that sometimes helps keep it from sliding up and down. And so she'll go ahead and lay back, and then we're going to start this a little bit further down here. And then she's really just going to take these two, and you're just going to pull this knee up as far as you can, and she's just going to pull, 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 really trying to get that knee into maximum flexion. And our goal is to get the knee to bend up as much as the opposite knee. In some cases, you might have some postoperative restrictions on the amount of motion that you're allowed, so just refer to those instructions after surgery. And so she can let that back down, she can push her knee back down, just push your knee on back down, slide. And if you notice that we've taken her shoe off, so the sock is on the surface, and really a sock or something like that, you can put a little face towel, just something to help decrease the friction so the foot slides nice and easy on the table. And so she'll pull the knee back up again, pulling it into flexion, stretching the knee out like that. Next exercise is called ankle pumps, and it's not necessarily working out the knee, it's just sort of reestablishing circulation in the extremity after surgery. And so real easy, it's pulling the ankle up, so she's going to just pull the ankle back up as far as you can, start working these muscles in the front of the calf, and then she's just going to push that ankle back down as far as she can go. You can do it with your shoe on or your shoe off, that doesn't really matter. And then she's just going to go back and forth like that. That'll help reestablish circulation, decrease swelling, and real simple exercise we do right after surgery. Next exercise is called quad sets, and this is a simple exercise we do right after surgery, and it's really just trying to reestablish, reactivate our quadriceps muscle, which is the big muscle right on the front of the thigh. And so the easiest way to sort of train yourself to do this is to think about pushing the knee, or the back of the knee, straight down through the bed. And so using our model here as an example, you can see how our quadricep is relaxed. She's going to push the knee down. Just like that. You can see how her knee wants to straighten out. You can see her quad start to contract. You're going to hold that and then relax. And I've got my hand underneath here just so I can feel how much she's pushing the back of the knee into the table. And then she'll do it again. You can see the quad tighten back up. She'll hold that and then relax. And that's how you do that exercise. Next exercise we'll call gravity-assisted flexion and extension. Let's use the right leg as the injured one, the one without the shoe, and then the left leg will be the uninjured side. The uninjured side is going to help the injured side move up into full extension and help it move back down into flexion. So she'll take the uninjured side and wrap it back around the leg here, and then she'll use that leg to help straighten the injured side all the way up, and that helps reestablish motion. It helps reactivate the quad muscle, and so she can hold that, and then again using the uninjured side, lowering the leg back down, just sort of spotting the injured leg back down into flexion, just like that. And it's helpful putting the knee just right at the end of the table so you can get the knee all the way into 90 degrees, and then you can just go back up again, and then right back down. Good. Next exercise is called straight leg raise, and this is done with you lying flat on the table, and you're going to start off with the injured leg completely straight like this. We'll bend the uninjured side up like that just to provide a stable foundation to do the exercise, and while keeping the knee straight, she's going to lift the leg straight up in the air. You're going to lift it up to about 45 degrees from the floor, just like that, keeping the leg nice and straight, working that quad muscle. You'll hold it, and then she's going to lower it back down towards the table. And then she can take a little break, and then she'll go right back up, and then lowering it back down. All right, this next exercise is called active knee extension. You'll notice we put the bump underneath the knee. I told you earlier not to do that, but we're only doing this just to help with this particular exercise. So the bump goes directly underneath the knee, and then she's going to work on straightening that knee out from that position. So she's going to activate her quad. We're going to lift that leg up, and she's going to get that knee as tight and as straight as she can. You can see how she's getting that knee all the way straight. She's going to hold it, really firing that quad muscle, getting it nice and tight. She's going to hold it for a little bit, and then she's going to let it back down, and then she's going to straighten it back up again. That's it. Good.